Pledge of Allegiance in a moment of silence or prayer, whichever is your choice. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Is there a motion to approve the minutes of July 6, 2020?
I'd so move.
I second.
All those in favor say aye.
Aye.
Is there a motion to approve appropriations ordinance number 28?
I move we approve ordinance number 28.
I'll second that.
All those in favor say aye.
Aye.
I'll declare the public input session open for any items not on the agenda. Seeing none, do you have any in on the computer from, okay? Does the
No, I have
bench
none.
have anything? Okay, I'll declare the public input session closed. Is there a motion to approve the agenda as distributed?
So move.
I'll second it.
All those in favor say aye.
Aye.
Okay, the first item that we have, 2.1, is COVID-19, and I'd like to call on Dr. Sheila Gorman to make a presentation.
Good morning.
Good morning.
I'm Dr. Sheila Gorman, and I am serving dual roles as medical advisor for the McPherson County Health Department, and I'm also Chief of Staff at McPherson Hospital. Today, I present the City Commissioners with a letter strongly urging the establishment of a city ordinance that requires wearing of face masks in public. This document is sent with the approval of 14 medical providers in McPherson. In brief, the document states that face coverings in public are one of the 3 inexpensive and readily accessible ways of decreasing the spread of COVID-19. The other 2 being social distancing and appropriate hygiene. The increase in COVID-19 cases in McPherson County indicates that the current recommendations, which encourage the use of face coverings, have not been adequately effective in controlling the spread of the virus in the setting of increasing interactions between community members. And one of the papers that I've distributed shows the activity of COVID in McPherson County. And you'll notice there was a glorious period where we had no cases for several days on end, and then more recently we've been hard pressed to have any days with no new cases. Recently they've been increasing pretty dramatically. Our most recent statement is that we have had 96 total cases at this point, and that's going up daily. The governor has opted to mandate mask usage in public as a means to combat the statewide increase in coronavirus activity, and the McPherson County Commissioners have opted not to adopt or enforce a mask mandate. They offer to continue to recommend mask usage, but that recommendation has not been adequate in the past. One of the messages that I want to address, however, is the why of the request. The reason why the state initially closed the schools and issued a safer at home order was to flatten the curve and avoid overwhelming the medical resources and to offer some time for medical supplies to catch up to medical need. Thankfully, we have not been in a situation of overtaxing our hospital resources at McPherson to this point, although we are concerned about supplies, certain supplies of personal medical equipment particularly, and we're keeping a close eye on that carefully. And thankfully, our referral hospitals in Wichita have not been overrun, which has allowed us to continue to transfer our patients to higher level of expertise when needed. Although COVID activity in Sedgwick County has been increasing dramatically over the last month, and I included that graph also. we're keeping a close eye on that. That's certainly important because if ever we or our neighbors are admitted to the hospital with COVID and need to have additional services, we want to be able to send them where those services are available and not be in the very undesirable position of having to take care of ourselves or our neighbors and not have the expertise available that we need. So their activity is important to us. We really don't have a lot of handle on what they do, but I'm glad that you're hearing me out about what we should do here. So our challenge now is to try to strike an appropriate balance between community medical resources and community COVID activity. And what is our end game? We want to mitigate the medical impact of COVID on our community until there has been development and administration of a safe and effective vaccine. We cannot knowledgeably debate the pros and cons of the coronavirus vaccine at this point. There isn't one available. Experts don't expect it to be available until the end of 2020 or early 2021 at the earliest. It's a long time from now, and it's my hope that in that time, additional effective treatments for COVID-19 will be developed also to improve hospital outcomes for those who do contract the virus. But it's time to discuss a reasonable intervention that can be maintained over a number of months to benefit the most of society, including our fragile members, with the least amount of societal disruption. The wearing of face masks in public is a well-established means of decreasing the spread of virus in the community, which would reasonably be expected to decrease transmission of illness in local areas where people gather, such as businesses, places of worship, and in the near future, schools. This in turn would be expected to result in less absenteeism due to recovery and quarantine, which then supports these entities' abilities to function without disruption. The wearing of face coverings also increases the safety of these venues, which then allows our fragile neighbors the ability to increase their interaction with others without accepting more risk than is necessary. In summary, because of poor participation in previous recommendations for face mask usage, COVID infections have increased dramatically in the community. Therefore, I join my medical colleagues in making an earnest plea to our community to wear a face covering in public and in asking the city commissioners to reinforce that plea with a city ordinance that face coverings be worn in public. Thank you for your time and attention.
Thank you.
Any questions for Dr. Worman?
I don't.
Okay. Next, I'd like to call Erica Seltzer, if she would like to make some comments. You might tell us your role so far
Sure.
in the coronavirus testing.
I'm Erica Selzer. I'm a physician assistant here in McPherson. Over the past 4 months, my main function has been testing for COVID for the hospital and the county. Most of the positives in the county have been seen and tested by me. Recently, there's been a tremendous uptick in positives in McPherson County, and it's this uptick is what's prompting Dr. Gorman and myself and the rest of our colleagues to ask for a city ordinance for face masks. Our current system in place is a collaboration between the County Health Department, Urgent Care, and the hospital lab. We are very, very efficient. That, however, is not the case outside of McPherson County. We get several calls on a daily basis from people outside of McPherson County asking if they can come to our facility and be tested for COVID. Tests are available outside of the community or of the county. However, patients have to wait several days just to get tested, and then they have to wait several more days for test results. In comparison, we're able to test people same day, and we usually have the results back in about a day or two. That's only possible because of the amazing team that we have in place here in our community. The success of our current system is only possible because of the adaptations we've made over the past 4 months. Our testing capabilities have increased substantially, but we are still limited by a finite number of tests we're able to collect and process in a day. This is the reason why we're asking that the public wear face masks. We are asking that individuals make personal sacrifices for the greater good of the community. By wearing face masks, we as a community are able to decrease the spread of illness and make McPherson strong.
Any questions for Erica?
I don't think so.
Okay.
I don't.
Yeah, Yeah.
Or Mayor Kruger.
Yeah. Do you want to ask a question?
Yeah, is that possible, or
Yes.
were questions only
No.
from?
No.
Okay. When you say uptake
Erica?
and, do you need me to step forward?
Yeah, right here. Tell us who you are and
I'm Jessica Lynham. I'm from McPherson County. When you both said uptakes, and I believe your number of positive COVID cases was 96, which is different from what's currently on the County Health Department's website, so I just wanted to clarify.
The county health department at 10/12 last night issued the next four, 93 through 96. So you may not have that one if you didn't see it late last night.
Thank you. Well, I printed this morning, so it wasn't available. But, so my question is that number, the total number from the onset? What is the start date? Because you keep saying significant uptake in numbers and then 96. So is that the total number of positive cases in McPherson County from the onset, or do we have 96 new cases?
No, ma'am, that's the total. The 4 new ones were announced just very recently, like the mayor said, but our total has been 96.
Since the onset?
That's the onset.
Okay, thank you for the clarification.
Yeah, and
No, I don't need the mic. I just want.
Oh, I apologize, I'm sorry.
okay, and for further clarification, we've had 96 since we started testing. So that's a lot for a rural county, if you look at the other rural counties around. The other thing is that we have had 82 that have recovered. So that leaves us 14 active people out there. And that's where I want to make a remark on behalf of the director of the health department, because she is doing other things this morning, and I said that I would cover this notice. If you are been in contact with someone, which is a much larger number than this positive, and you get the test, you have to stay in quarantine, or you should stay in quarantine until we either get your results back, or if you get even a slight positive, they will ask you to come back for a second test, possibly, and you may have to wait the whole 14 days. So we don't have just a few people out there. We have a lot of people waiting to find out, are they positive or are they not positive? The biggest violation that we have had in the community that enables community spread is that people that have been asked to quarantine do not stay in quarantine. They may not wear masks, they may wear masks, but if you are asked to stay in quarantine until you've been released, you may stay in quarantine up to 14 days. If there's any glitch in this testing and they need a retest, that 14 days could be a little bit longer. And the reason for that is up to 14 days we should know whether you have it or you don't have it. And the other point that I really, the last 4 are a symptomatic female in her 80s, a symptomatic unknown exposure, symptomatic female in her 60s with a known exposure, so somebody exposed her and she knew who it was. The 95th one was a symptomatic female in her 30s, and I will say the last 15 to 20 have most of the time been under 50. So these are people that are active in the community. And so that is a concern. And then the 96 was a male in his 50s with known exposure. And that's all that we put out. We do not put out all personal information. It's a part of the HIPAA law, as well as just the way that the system works. So in all of this, we are not trying to take away anybody's freedom. What we're saying is, how do we stop community spread before we become a hotspot? that's what we wanted to bring this information before you. I've spent the weekend, I've taken between 20 and 30 emails. I would say there's a slight advantage to not wearing a mask versus wearing a mask, but up until the last little run, it was pretty equal for a while. Wearing a mask was there. I've also read 9 professional journals, and I have digital copies of that. If anybody wants to read them, you can't sleep, I'll give them to you. But I did stay awake to read all of them. The beginning of this pandemic, we said by professionals, including Dr. Fauci, wearing a mask did not do any good. A few weeks ago, he changed his mind, which we still don't know, from my opinion, because the data is so fresh. We're not looking at something that we've been able to say, okay, let's look at this, what happened, everything that's the case, and we can do it. We do know that everyone that has relaxed the mask and done everything has turned into a hot spot. I gave up a wedding of my granddaughter Saturday in Florida. I missed the largest outbreak of coronavirus anywhere in the country in one day. She was not happy that my wife and I were not attending. If you're 21 years old and you're getting married and it's the highlight of your life to that point, it's not a good thing. But I am thankful for, like, we're putting out our meeting today on Zoom or GoToMeeting or whatever you use. The church streamed the wedding, so I saw it live. And thanks to, I don't have an Apple, my wife does. What is that thing that you can? FaceTime. Oh, there you go. I'm still a dinosaur. Anyway, at the beginning of the reception, they FaceTime us so we could see that. I got the biggest bang for participating in everything, but I didn't have to be exposed. My wife is high risk. If you meet her going down the street, you will never know she's high risk. The other people in the community that are high risk, anybody with diabetes, a leaky heart valve, other coronary situations, maybe an asthma thing. You don't know who you're meeting. So I like the t-shirt back here as I wear a mask to protect you. That's what I'm doing. I saw a specialist on Channel 12 here last week saying this will not deprive you of enough oxygen. It will not cause you to have too much carbon dioxide behind this mask. But what the two things that I see after reading all of these pages, probably about 200 over the weekend, it keeps you from touching your face. I've tried to be aware of all the times I touch my face. And I'm surprised how many times I touch my face that I wasn't aware of when I wasn't concentrating on it. I touch the mask, so when I take the mask off, I do these things here with these ear loops instead of the part here. I have a cloth mask, and thankfully I have a cloth mask that I can put a surgical mask inside. So according to these reports, I should be stopping 80 to 90% chance. That is pretty good. How do we get the community to take this seriously? How do we, when you're part of a tracking contact, do we get you to test? How do we get you to wait for the results? How can we go into a store? We want to keep our economy going forward. There are two things that we are fighting. We're fighting this pandemic, and we're fighting economic survival. We are one of the best towns in Kansas economically. I've been waiting, I was hoping to have it by this morning for the unemployment. Last time we were 5.2, I hope June was going to be under 5. That's phenomenal for this time. We need to keep that. We can't afford for people to be put in quarantine and not go to their jobs. We need them on Main Street businesses. We need them in other commercial businesses. We need them in our industry. I just exchanged emails with the Pfizer plant manager this morning, congratulating them on they at least have been designated for one of their research things for a vaccine candidate. Now, as the good doctor said, we've got ways to go to test, but at least we've moved through the next hoops. So the biotech and Pfizer in this country are moving forward on the tests. There will be times when and if we have a vaccine, that people don't want to take the vaccine, just like they don't want to take other vaccines. And I understand that. Personally, myself, I've only had regular flu one time in my life. So I think to myself some days, why do all this? I'm probably not going to get it anyhow. But if you're concerned about your immune system, you should take your vitamins. I'm not going to tell you what to do, but you can go Google and you can get all kind of advice on how to increase your thing. Vitamin C, zinc, a couple other things. Do all that if you're concerned about your immune system, or talk to your doctor about it. That's probably even a better source. I'm not giving medical advice. I better make that statement right. City attorney's giving me the evil eye above his mask in a thing. But we want to keep the economy going. This is livelihood. To put a mask on, I put a mask on to go to pick up a meal last night at a restaurant. They had it ready. I paid them, and I walked back out. As soon as I walked out the door and nobody's around, I took my mask off and got back in my vehicle. I went to church. I wore my mask during the church service. So all told yesterday, going for food, going to church, everything else, I probably didn't have a mask on more than an hour and a half. That means the whole rest of the day I was unmasked, because I'm either out in my backyard or nowhere close to anybody else, or inside my car. I have a hard time understanding the people's emails that say, I'm taking away your freedom if we pass this. It's not a taking away of freedom. We're asking, are we at a point where we could have something like this to care enough for others that we would be willing to do it? If we had an ordinance, the ordinance does not last forever. Some of us here may only want 30 days. I put in an ordinance that was here for a target to shoot at, with as many exemptions as I can get, including little children, hard of hearing, you name it, is there. But how do we put something together that keeps our attention on this? And I was joking with the city attorney before we started here. One thing of putting this out, I raised the attention of what's going on here in the community. So anyway, those are remarks. A lot of them can be found in the McPherson County Health Department latest report. Fortunately, right now, we have no one in a hospital, and fortunately, we have not had a death. And that's the way we want to keep it. But if we keep on picking up these cases at the rate we're going, we're bound to end up in passing it to somebody that is bad. What have we done as a city before this? We have stood up an emergency operations center, what's known as an EOC. We met every week. We brought in different segments of the community. We have felt we didn't need to meet every week because we don't have an active cluster or anything, and now we've pushed that back to meet on a monthly basis. But we have had a liaison group as part of that EOC. And that liaison group has decontaminated both our clusters. When we have come into contact in fire and police with somebody suspected of the coronavirus, that liaison group has decontaminated police vehicles, policemen themselves, immediately after that, and decontaminated our fire equipment and our firemen. We've been doing all of these things to try to keep all of the workers in the city safe to come in contact with you. Are we ready for another step? That remains to be seen. But I did want to bring it up. I wanted it to be discussed. And if any of the rest of you that came for this morning want to make a comment, you're welcome to come up here and tell us who you are and make your comment, but please keep it to a couple minutes. This is not a long thing.
My name is Annette Carr, and during this time, it has been a time of uncertainty, a lot of stress. That stress also creates an unhealthy situation for us. When I've gone to a restaurant for a carry-out, and the 3 women working for the restaurant did not have masks. That told me there's 2 things that in this time of uncertainty, 2 things that I've had control over: where I place my body and where my discretionary funds go. From that time, I am letting businesses know I will not support their business. Before I go into a business, before I choose to go to a business, I will call and find out, does your staff wear a mask? Something simple. That empowers me, and in this time of absolute uncertainty, that empowerment is very, very important. Thank you.
Thank you.
Someone else? Michael?
Michael?
Good morning. Mike Yates, I'm a local business owner. I did have some questions to follow up, just to clarify. Back in February, March, when we first saw COVID starting to come on the scene nationally, without trying to get political, there was a lot of downplaying at the national levels, which caused some severe shortages in the availability of testing. And my question is, we've had 96 confirmed cases. Early on, I had a good personal friend that was told that because she didn't have any symptoms, that they couldn't afford to give her a test. They couldn't spare a test. So she was told to just do 2-week quarantine, literally just as a precaution, which I understand and I'm not saying as a criticism. But my question is, over the course, I guess my first question is this. If somebody came in to an office today, a health office today in McPherson County, and they showed no signs of COVID, could they be tested?
We only test asymptomatic people if they've come in contact with a confirmed
Right.
positive.
Okay. So yeah, and then like I said, I'm not attacking. I'm just, and that's because we still to this day have a shortage of tests.
No, that is because we don't
So we don't test asymptomatic unless they've been in contact with a confirmed positive, because we have limited capacity to test, basically. I mean, the resource of the testing, it's not the tests themselves, but it's the bandwidth at which we can test.
It's the flow.
Correct.
Essentially for the greater good of everyone, so that if there was an excessive number of tests that were being done
Mhm.
in a limited resource, that means our turnaround time is a lot longer. And like as the mayor was saying, people are expected to stay in isolation while they're waiting for those results. And if it
Right.
goes from being a 1 to 2 day turnaround like what we have now to a 4, 5, 6 day turnaround, that becomes more and more onerous and less likely that people will follow through with it.
Sure.
And so that's why we're opting to funnel those tests towards people that are actually at highest risk of testing positive.
Sure. Okay. And as of right now, we have fewer than 100 confirmed cases, which thank God. So we have a lot less data to work with than looking at the numbers nationally. But nationally, we look at it, and I've been trying to keep up on it. Experts estimate anywhere from 40 to 60% of people who contract COVID will contract it in a way that they are asymptomatic themselves. Would you agree with that number?
There's been lots of data all over the place, and that's probably accurate.
40 to 60%, somewhere in there, around half. Okay. So, do you have any data at all of how many people have been either told to take a 2-week quarantine as a precaution without testing? Do you have any, I mean, ballpark?
When it comes to quarantine, that's something that is instituted by the health department,
Mhm.
and although I'm their medical advisor, I am not that hands-on
Sure.
to be able to give you that number.
Sure.
No, I'm sorry, I don't have that.
No, that's fine. That's
There
fine.
are, however, quite a few people that opt to not be tested and just
Quarantine
themselves.
without,
So-
they choose to not be tested.
So our lab confirmed positives in reality are probably lower than the actual amount of people in town with it, because people choose not to be tested and just have the 2-week quarantine.
Right. I guess that's kind of, I think that's the scariest concern for a lot of people is COVID-19 obviously has some incredibly adverse health complications for some, but other people can have it and not show symptoms, and they can be walking around as a carrier, and we won't know unless they happen to come in contact with somebody that is a confirmed positive. So that's one of the disturbing parts about this whole environment. So, in any case, I will keep my opinion portion abridged, but I do understand people's concerns. This is not fun. This is not something I asked to do. This is not something I think anybody wanted to do. But I think there have been a number of studies that have shown the science that this does help. It is a protective measure, much in the way that every seatbelt will not prevent every auto fatality. This is not the be-all, end-all, solve-all of our situation, but it is one more safety precaution that we can take to help reduce transmission. I think the other thing too, kind of echoing what the mayor said, although this is not fun, and even if the city mandated this, I would not see this as an infringement of my freedoms. That's my personal opinion. But as a business owner, that's how I would look at it. Any more than pulling over to the side of the road to allow an emergency vehicle to pass is not an infringement of my personal freedoms either. I think everybody in this room, whether you're pro or anti-mask, we would all like to get things back to normal. And for the people who do believe that the masks help, I think that's really our step to try to move in that direction to get back to something that resembles normalcy. So thank you for answering this question.
Thanks, Michael.
Anyone else here that came this morning that would like to make a comment, please come forward, tell us who you are, and make your comment.
My name is Tracy Miller. I work at Pfizer. Out at Pfizer, we are required to wear a mask out at work. And I did attend the Shop the Night Away on Friday night. I did wear a mask when the store is required to wear a mask inside. It was very humid, which was the disposable mask at that time. Throughout the night, my mask kept on getting wetter because, you know, of the sweat and stuff. So I still think in my COVID is going to be here, and by the time we get a vaccine, and hopefully it'll be soon, there'll be different strains of it, just like the flu. They're going to take a hit or miss on the vaccine when it comes out anyway. We are now from March, we are now in July. To me, it seems if you cannot social distance yourself, because I have no problem with telling people to back up. The mask going outside in this humidity and the heat when you're just walking down Main Street is going to be hard for people because it is hard. The humidity is hard anyway on people, on their breathing treatment, on any type of breathing. I think it's up to the original business owners if they choose to require a mask or not. It was nice to see businesses have people in it for a change this past Friday for the economical point of view. I just feel that we should have it, I don't think a mandate and telling people to wear a mask because people are so, it's not confusing to them, but they're angry. You know, they're being told to do this and do that. We've had a shutdown. I have a senior in high school. It was his suckiest year ever. But being told to wear a mask when you go outside is hard to take. We've had two big bashes down at the Lakeside Park. One requiring a mask to be in the park, and another one without. We've also had a public forum where the masks weren't required. So, where do you give on the mask wearing here in town? And that's where I stand.
Okay.
Thank you. Please come down.
My name is Sherry. Sherry Graham. I live in Mound Ridge. And I just have a few questions I guess I wanted to pose to you as you consider a mask mandate for McPherson. Back when the state was first beginning to open back up, Dr. Lee Norman specifically stated that we are not going to worry about the case numbers because they're going to go up as we test more, as we come out of shutdown, more people are going to be exposed. Healthy people are going to get it. They're not going to show symptoms most of the time. So my concern is, you know, the data that now all we hear about are case numbers going up, whether it's in Kansas or nationally. It's all we're hearing in the news. It's all we're hearing, you know, from our health departments. And my question is, you know, if we look at the numbers we really need to be concerned about are the deaths and the hospitalizations, because that is showing the severity of people that are getting these. And to me, you know, McPherson has only had, you know, no deaths, and now 96 cases is the new number, or the 96 cases. But we've had 0 deaths and only 7 hospitalized, and currently no one in the hospital. To me, that is showing we're having more people getting this, but still the deaths and the hospitalizations remain low, which tells me that the severity of this continues to go down as more people are exposed and I think, like, you know, they've said, a lot more people have had this and don't even know it and have immunity to it already. And so the more people that the healthy ones are out there getting exposed to this and getting it is going to protect those that aren't. And the further we spread this out by masking people up, telling them to stay home, whatever, the longer we're stretching this out and the more problems it's going to cause, in my opinion. The next question is,
Do you want to answer
yeah.
to that?
Do I want to answer?
Do you want to respond to that, spreading out?
I think we agree on a lot more than we disagree on. but with the increased incidence of disease in our community, you know, yes, we're tracking those numbers, how many people have it. And it's kind of a marker for what to expect, because we expect a certain percentage of people who get it to be sick enough to be in the hospital, and a smaller percentage of that people to actually end up dying. And you're right, those are low. But that's what we want to avoid. And I agree with you that our activity is low enough that I would not recommend shutting down businesses or restaurants or not opening school. I would not be in favor of those kinds of restrictions. But I would be in favor of wearing masks, because I don't put that on the same level of restriction. That's something that we can easily do that makes a difference. And I think your point is valid. You're thinking about, well, aren't we all gonna have to get it anyway? And that's I've had a lot of conversations with people and who have had that same opinion, and I'm not ready to give up yet. I might be proven wrong down the road, and history will have to tell. But I'm still have a chance that if we can develop a safe and effective vaccine, that's one way that we can also get immunity without having to go through the illness ourselves, and without putting people at risk unnecessarily of severe illness and hospitalization and death. And also another thing that comes to my mind is that every time that we do have somebody who's sick, then they're out of commission, and they are at home in quarantine, and their family is home in quarantine, and that's having a tremendous impact also on our businesses, and it's going to have a tremendous impact on our schools and our community participation. But so much of what you say, I think we agree on more than we disagree.
Okay, you have another question?
Yeah. I guess another thing was that, you know, the goalposts just seem to continually be moved. Originally, the purpose of, you know, shutting down and everything was to slow the spread and flatten the curve, not overwhelm our hospitals, and as we've already seen the numbers, that's not happening. You know, it seems now that the mask mandates are being touted as a way to really totally stop the spread. And it's not going to happen. Viruses can't be stopped. They'll always be here. They'll always make their way around the population. And, you know, what we need to be doing is protecting those that are vulnerable, getting this out there, getting people exposed, getting that natural herd immunity so that we can move on. And to me, some of the measures that states are trying to take is just prolonging this and causing states to further have issues. But the last thing I just wanted to point out is that if you know, in the healthcare setting, if masks are considered PPE for health workers, why are they not being considered as PPE then for the general public? You know, when you are a health worker, you have to be fitted for whatever type of mask that fits your specific, whether you're a surgeon or a nurse or whatever, you know, depending on what position you have, you're fitted with a certain type of mask for that position. And all kinds of things are brought into, you know, into consideration when you're doing that for safety reasons. You know, what kind of environment do you work in? Is it a sterile environment like in the hospital? Is it out on a construction site? Is it, you know, the person's physical health is considered. How labor intense, you know, your job is. If you're a construction worker and you're out, you know, in this humidity and putting a mask on, what is that going to do to that person? So, you know, OSHA requires, if you require PPE for your employees, that they have to go through, you know, safety testing. They have to go through training. To know how to take care of it, to know how to wear it properly, you know how to dispose of it properly, all of these things. And the general public is not being properly, in my opinion, is not being properly trained on how to use masks, how to properly dispose of them, what are the limitations of masks, what they can and can't do. I've heard story after story of people who are having headaches and nausea, extreme fatigue, and much worse problems because they're having to wear masks. Many use the argument that doctors and medical professionals wear masks all the time. So, you know, they're in surgeries for 5 hours and they don't have problems. So what's the big deal? Masks are safe. But I recently found out that hospitals are built in a way that their air exchange systems allow for a higher percentage of oxygen to be circulating in those rooms where doctors aren't masked up because of, you know, safety measures that they have to do. So they're in an environment that allows them to wear a mask and still be able to get the oxygen that they need, because they are being fitted with a mask and an environment that allows that. So masks were never really meant to be a mass, you know, mandated for the masses. They're intended to be worn for specific activities, to be fitted properly, to be properly trained on how to use those masks. And to me, if you mandate masks for McPherson, you're going to be opening up a lot of problems for employers and employees knowing how to handle this. What do we do when we've got people with medical issues that cannot wear a mask? Are employers going to fire them? And if they fire them, are they going to be facing wrongful termination lawsuits? I mean, there's just all kinds of stuff that are going to cause problems if people have to wear masks. So I just wanted to throw, I guess, those things out just to consider. Just saying, go just put a mask on. There's much more involved in this, health-wise, for people. One example real quick. My mom, she has some health issues. She can hardly wear a mask to go from the car into the doctor's office. She almost passes out. But they require her to do it, so she does it. She went in this past week to, she has macular degeneration. Went in, she had to wear a mask the whole time. She's sitting there, they're testing her eye pressure. Her eye pressure was really high. And they said, come on, just breathe, breathe. And her blood pressure was going up, eye pressure was going up. These masks affect people differently depending on their bodies, depending on their health. And you really have to be careful because people don't realize that. And they're going to be putting a mask on thinking that they're doing what's right and what's going to help. And it could be putting their lives in danger. So just want you to consider that as you look at this mandate for McPherson. Thank you.
Thank you. You want to respond to any of that?
I agree that there does need to be a very aggressive education component. If that is something that the commission decides to go forward with, as I suggest, then I agree that people need to know under what circumstances they need to wear it and what circumstances they don't need to wear it. And people do need to know if they have medical conditions that would make it unsafe for them to wear a mask, they need to not wear a mask. And there are a long list of conditions that really should not, you know, we don't want, our point is to keep people healthy. We don't want to compromise their health further. And the cloth masks that we're asking the public to wear, they don't have to be face fitting. And so they don't have to be fitted the way that an N95 mask has to be fitted. And we have, if there's questions for the individual about whether it's safe for them to wear that mask or not, they should definitely talk about that with their physician. The vast majority of people will be able to wear it safely. But for those who cannot, then they should not.
Okay. And I
Thank you.
would say that in the model ordinance that we were looking at, we have a lot of exemptions that would have exempted somebody like your mother. Okay, so we have tried to take all those things into fact, even as I think I mentioned earlier, if you're hard of hearing and you are relying on somebody not having a mask, you can ask them to remove their mask so you can read their lips. You can't read their lips with a mask on. But you can tell when somebody's smiling with a mask on. You can tell by their eyes. So, anyway, anyone else? Come on up.
That segues nicely into my comments. My name is Mrs. Woods, and I live in McPherson County. I want to thank you for letting me voice my concern about a mask ordinance in McPherson. One of many concerns I have is how this will impact the valued members of our disabled community. You may not be aware, but in mask-mandated cities, people are being routinely turned away and shamed for not wearing face masks, even when it's been explained that they have a valid medical reason why they can't wear a mask. Like the doctor mentioned, there's a long list of reasons for people to be exempted from wearing a mask, such as migraines, anxiety, epilepsy, lung disease, hypertension, asthma, and cerebral palsy. My husband and I have 6 children, and Elena is our 14-year-old daughter with multiple disabilities. I forgot her picture. I was gonna hold it up. She wanted to be here today, but she was afraid she would be forced to wear a mask, and she just can't. There's Elena. She asked that I come here today and request that you not pass this ordinance. She is a very vibrant and active 14-year-old. She loves to be around in the community, and last year she participated in Special Olympics. She was even, she got to do the torch run and run here in McPherson, which was just one of the highlights of her life. She has, as I said, multiple disabilities, but one that really affects her ability in the community to get around is she has vision loss. She can't see out of half of each eye, so her vision is cut in half, and she's legally blind. Normally, she just does a good job scanning. But what we found when she's had to wear masks in recent days when we've gone to doctor's appointments or such, we want to be respectful. Of course, we're going to wear a mask in that situation in a healthcare setting. But what she told me was, Mom, that cuts down on my vision. I can't see anything where I'm walking now, and it's dangerous for me to walk with that mask on. And I said, that's it. You must not wear a mask when you're walking around. If you're sitting, that might be one thing, but to navigate, it cuts it down to about 25% vision for her. Well, as you know, when the governor passed the mandate, several counties opted out and some opted in, and Dickinson County was one of the counties that opted in. And my mom and Elena were on their way to Kansas City for a medical procedure. It was an important procedure that had been delayed months because of COVID, and they stopped at a restaurant in Dickinson County for lunch. My mom was aware of the mandate. She was aware of that being passed in that county, and because of the attitude of the restaurant, she didn't want to risk the shame and embarrassment of being turned away. And so she told Elena, you really need to wear the mask while we get to the table. If it had been me, I would have stood my ground and said, listen, we're going to go in without the mask, and if we need to call the ADA hotline, then that's what we'll do, because that would be unlawful for them to refuse her entry. But I don't think that a lot of people with disabilities are going to be able to stand up for themselves like that. Unfortunately, on their way to the table, Elena fell down because she was unable to adequately see. Thankfully, she wasn't hurt this time. Now she has anxiety over even trying to go to another store or a restaurant in a city with mandates. Once she gets through the door, will she be met with angry and fearful looks from other customers and employees? Yeah, I think so. Could she even risk having somebody take her video or take pictures of her to shame her? Yeah, I've seen firsthand accounts of that happening right now in cities with mandates. I'm asking that at the very least, if you go forward with the mandate, and I'm really thankful to hear that you have a list of exemptions that are included, I want you to make it very clear to businesses that if somebody tells them they have a disability, if they have an invisible disability or a reason to not wear a mask, I'm just asking that you make it really clear to them that they need to honor that, they need to show respect, and that we need to make these businesses a safe and welcoming environment for our disabled community. Thank you for your time.
Yeah, thank you.
Appreciate it. Thank you.
And one of our clusters was a disability cluster, and we worked hard to go through all the things that they had to do. So we were sensitive to that issue.
There are still stores like Chipotle, Quick Trip, Target. There are specific stores that are saying no exceptions,
Yeah.
none. We
Yeah.
don't want it. We don't care.
Yeah, and I'll remind you that I cannot control that.
Yeah.
But
But passing
if
a mandate is-
if we ever pass something, I've already talked with the police chief. We'll spend a week to 10 days of education. We don't want to give out tickets, and one of the things in our model is that as a low, doesn't matter how many times, it's only $10 and there are no court costs. So we would rather educate and give you a warning than to get you to do it.
For us, though, it would need to be for that business.
Yeah, well, for the business, but, and for you to, if you can't, make a better effort to comply. But there's all kinds of problems in this, understand that. Anybody else?
My name is Jessica Lynham. I live in McPherson County. I thank you for the updated information because I wasn't. I guess I didn't see on the website the updated information from the county health department. My personal story is that I don't prefer to wear a mask, but like many others, out of respect, when I would go into certain places, I would wear a mask. Obviously, when I took my child in for his doctor's appointment, I wore a mask. I did not make a homemade mask. They feel too thick and constricting to me. So while I was able to just find a basic mask, number one, they're not sterile. I think what we have to keep in mind is we're asking people to basically walk around with Petri dishes on their faces. And not everyone is comfortable not touching and adjusting that mask. So we are still putting germs that close to our face. We're asking people to do that. In the doctor's appointment, while we were there, because we had a 30-minute wait out in the waiting room, I began to feel very dizzy. When the nurse called us back and I stepped up to walk back, I almost fell over. I said, I feel like I'm going to pass out. Do I have to wear this? And she said, well, just keep it on until you get to the room. Once you're in the room, you can pull the mask down. I personally don't have, that I know of, a health condition that would have caused that. But how many people might experience that and may have a health condition and may still, under the mandate, feel obligated to continue to wear that mask even under some kind of duress? Do they even know that that's duress? Are they just uncomfortable? And we've put such a shame, there's such a societal shame with removing a mask now, that how many people are going to feel so guilty about not wearing a mask that they're not willing to take the mask off to get the air that maybe they need, especially like the other woman was saying, out in the heat and the humidity. And if there's a fear of any kind of fine on top of that, whether it's a small one or not, that just perpetuates more of what we're already seeing, which is the fear. There's such a fear associated with this. And I will say, I feel like McPherson County has done an outstanding job flattening the curve and slowing the spread. When we look at the numbers that they mentioned, currently in McPherson County, that's 4 out of 10,000. 4 per 10,000. That's 4 10,000ths of a percentage. According to the CDC, in order to be an epidemic, that would have to be 15 per 100,000 for 2 weeks. We are far from an epidemic status. And so I wonder, and I'm just talking in McPherson County, given that our current status is 4 per every 10,000, is it really necessary to mandate masks? And are we just asking for more problems than we're able to keep up with? What if someone did fall in a business and there was a mandate and the business lost their choice to say, you must wear a mask in here? So if there's a mandate passed, business owners lose their choice on whether they want to mandate a mask in their store. Who then is responsible if someone is injured? Would that be the city or would that be the business? Because there's so much societal shame involved. Are people willing to show up and say, okay, I don't feel well, I'm going to have to go outside and pull my mask down? Are they even aware? So those are some questions that I have. Who is responsible for someone who is guilted or shamed into making sure that mask is on. Secondly, the recommendation that was given by the governor and the health department currently is that we wear masks only when it is impossible to physically distance.
That's
So
true, and
I think
that's-
we're doing a really good job in here of even keeping that 6 foot requirement. I don't see where
I think, I'm going to interrupt you.
Okay.
I think you would have to read the mandate. We've taken all those things into consideration. Liability, do you, as attorney, want to say something on the immunities that have been passed?
I'll say a couple things. One, I'm not gonna give general legal advice to the city businesses. Not now, not ever. I'm not allowed to do that ethically. Under the state law, there is a provision for tort immunity, so immunity from negligence for COVID-related defense activities. So, and that's my wording, that's not the way it's phrased in the statute. So the state statute has already taken care of some of the concerns that you expressed. On the ADA concerns, it's like that for anything that is out there. That is, there is not a reasonable accommodation under the ADA. There are avenues to address that, and those are federal avenues. Those are not city avenues. But it is not a state or city cannot legislate because it may someday create a violation of a different law. That's not the way the world works as far as legal liability goes.
So for clarification purposes, am I understanding correctly that the city would hold no liability?
No, we would have absolutely no tort liability for passing an ordinance, this one or any other.
Okay.
Okay.
So because of my situation where I felt like I was weak-headed and obligated to wear a mask in the doctor's office, I personally took on the responsibility of doing research on whether masks are indeed safe 100% of the time. I have 13 pages that I can hand each of you. I can also email that information that says
You can email it.
I will
would
do
be
that.
fine. And like I said earlier, I've got 200 pages that say they're 80 to 90%, depending on your layers, 50 to 60% of it's a real thin mask. So there's a variation, you're right, on mask, but there is nothing that's going to be 100%.
That's right.
I understand that. Finally, I would just like to say one thing that you mentioned earlier was, or someone mentioned, the empowerment that they felt by calling a business and asking, do you require masks? Likewise, for those of us that are not comfortable wearing a mask to shop for groceries for large families, sometimes it takes up to 2 hours to do my grocery shopping. I don't want to wear a mask that long. I'm not comfortable wearing a mask that long. Likewise, I like the empowerment of being able to call and say, do you allow people into your store without a mask to shop freely? And if that's not the case, then I have the choice to go elsewhere. And what I'm hearing right now from surrounding counties and friends of mine is, hey, I heard Reno County doesn't have mandates. What stores are available to shop there? Economically, we should be thinking about that. Are we driving business elsewhere?
We are thinking about it, and it's hard sometimes to imagine that you're going to drive a half hour to an hour if you have to wear a mask for a half hour. So anyway, thank you very much for coming today. Anybody else? Any medical response to anything that was said?
I do like the points that she brought up about, masks do come out of position and you do have to adjust them. And we're going to get better and better at that, and not having to do that. And she brought up the concern about, it's like a petri dish. It does get moist, and so there's going to be some instruction that needs to go on about care of these. Yeah, they got to be washed, and they do have to be taken care of. So there is a good bit of communication that needs to go on in terms of how to safely do that, because I certainly wouldn't want this recommendation end up harming our citizens. However, we've got the benefit of other people's experience and other communities and other nations' experience, actually, in face mask usage. They've been used very broadly, particularly in Asia for a long time, and they've given us a lot of information about how to do that safely and for larger populations and for long end up being sick enough that they have to be hospitalized. And a certain percentage of people who get it end up dying of it. And we haven't been overrun by that, but we don't want that to happen. And what we know too is that because of the long incubation period of coronavirus, that any changes that we make right now are not going to take effect until at least 14 days. It's, when we make changes, we're not gonna see a response in the coronavirus activity in our community immediately. It's not like we're driving a Ferrari, we're driving the Titanic. It doesn't turn quickly. So when we make changes, we need to make adjustments before we're in crisis situation. That's way too late. And I'm not saying we are in crisis situation, but with that increasing number of incidents, that's our warning. And I think we would be in error if we didn't accept that warning as it is and take some action. And we should take the action that's appropriate to the situation. I'm not advocating shutting things down. I'm not advocating backing up on businesses, restaurants, churches. I'm not saying that at all. I am advocating a much more simple, less intrusive intervention, and that's why I asked for the face mask ordinance.
Okay. I would just like to say that there's been a lot of information in the last hour plus. I would ask if you want to say anything or do anything more, or are you willing to take some time to digest all this?
No, I'd just like to make a comment. I look around the room, and I don't know how many of you remember the seatbelt activity that came out years ago, and how much pushback there was on seatbelts, and I'm not wearing a seatbelt, and I'm not going to wear a seatbelt, and you have to wear a seatbelt, and no, I don't, and yes, you do. This reminds me a lot of the seatbelt law that was put into effect. Only this law, or this ordinance that we're getting ready to take a look at, and may or may not pass, is not forever. Seatbelts are forever. Seatbelts are going to be here. I don't care whether you're 30 years from now, you're going to wear seatbelts. But it reminds me of that, how the pushback was on seatbelts. And you look at the same thing on motorcycle helmets. There's a lot of pushback on a lot of things. And like I said, keep in mind that this is not something that is going to be here for the next 50 years, that you have to wear a mask every time you go to Walmart or Dillon's or wherever. So.
Mayor, I'd like a little more time to digest some of what we've heard this morning and to do a little more research on this thing.
I feel the same way.
Okay.
And that we have a model ordinance. You can go out there and look at it. But I think that the three of us, the city attorney, ought to look at it in light of some of the comments that we've tried to cover a lot of bases with some exemptions. But I think we can easily look at it again. We will make a clear notice if we're going to bring it up again. Okay?
Mayor, I'd just point out that, I'd encourage you guys to go look out on Facebook at the comments. We've gotten 105 comments out there, and a lot of it's conversation back and forth.
I haven't looked at Facebook, but I've looked at about 50 emails, so I don't think the Facebook will be any different.
Right, I've received, over the weekend, I received somewhere in excess of 30 emails from different people. Yes and no and yes and no. So I would go along with the other two, and I'd like to wait till next Monday and make a decision next Monday as to whether it's going to be mandatory or not. And have everybody go out, take a look at it, read it, digest it. There's a lot of things in there that we've talked about today. There's a lot of exemptions in there that if you have this, you don't need to, and so on and so forth. So that would be my suggestion.
Okay, so we'll move on to the next item. Thank all of you for coming. Thank you for taking the time to give us input. Okay, call on CVB, Joni Ringy.
Thank you.
Good morning.
I was gonna give it to her. That's all right.
Go ahead.
I have one item today. After meeting with the Parks Department, my staff, and multiple community organizations, I'm here to present the following proposal to the commissioners. We were all saddened to hear that the Thursday night concert series had been canceled. The CVB has been fortunate enough to be able to be a part of this wonderful event over the years, and we all appreciate everything that Brian Hopp has done for our community and the local nonprofits. Following the mayor's request to seek alternatives, we have created Music and Movies Live at Lakeside. We have offered movies for years at the band shell at Lakeside Park and thought this was the perfect opportunity to add music to these events as well as to continue to help our local nonprofits. Music and Movies Live at Lakeside schedule is as follows. Music will be played on the east side of the band shell in the shade, and the movies will still be at the band shell. So here's the schedule. This Friday, July 17th, Music and Movies Live at Lakeside. This one will benefit Steps of McPherson. The music will be from 7 to 9 p.m., and Rosewood Lane will be performing. At 9:15, approximately, the movie will start, which is Trolls World Tour, sponsored by Lock and Load and Mattress Haven. On Friday, July 24th, we're going to do Music and Movies Live at Lakeside. This will benefit the Boy Scouts of McPherson. The music will be from 7 to 9, and Sam Unruh will be performing. At 9:15, the movie will start, and the movie is A Dog's Journey, sponsored by Hutton Construction. On Friday, August 7th, we will have Music and Movie Live at Lakeside. This will benefit Meals on Wheels and the McPherson County Food Bank. This will be from 7 to 9, and Why Not Us will perform. On Saturday, August 15th, will be our last Music and Movies Live at Lakeside. This will benefit Fuse. This will be from 7 to 9 p.m., and Petty Cash will perform. The McPherson Water Park will also be open that evening. We'll have lots of fun activities for the whole family provided by the McPherson Fire Department. The Snack Hole will be selling delicious food at each event, and part of their proceeds will be donated back to the nonprofits that evening. Bottled water has been donated by 24/7 Travel Store and individually wrapped homemade cookies from Kanaki's Meats and Sweets. These will be available to purchase, and all the money raised from these will go back to the nonprofit as well. Lakeside Park not only allows us to increase the social distancing in a reduced traffic area, and we will encourage masks. While safety is our #1 priority, we are also pleased that we can help these local nonprofits as well as boost the morale of the community with these events. We love our community and look forward to offering the Music and Movies Live at Lakeside starting July 17th and ending Saturday, August 15th at our beautiful Lakeside Park. Thank you.
Okay, well, that's the adjustment to the schedule, so everybody's updated. Okay, thank you.
Thank you.
Thank you.
Okay, we'll move on to planning and zoning, and Virgil's still here. Thank you.
Yeah, I thought all these people came because they wanted to hear these Zoom.
And I'll tell you, like I tell my wife, that's what you get for thinking.
I have 2 items for your consideration this morning. First is draft ordinance number 3337. It's being presented as a result of concern expressed by the public regarding individuals keeping beehives and impacts on adjacent properties within the city. The city recognizes the benefits of keeping bees as it relates to maintaining a healthy ecosystem. Staff believes that this ordinance reflects a fair compromise, allowing reasonable restrictions on beekeeping while also preserving the opportunity to contribute to the health of our ecosystem. The city attorneys reviewed the ordinance, and it reflects similar legislation in like cities.
I move that we adopt ordinance number 3337, an ordinance of the city of McPherson, Kansas, amending chapter 50 Article number 7 by adding sections 195, 198 of the Code of the City of McPherson, Kansas, establishing the allowance of and regulations for the keeping of bees within the city limits, and authorize the mayor to sign the ordinance.
I'd second it.
All those in favor say aye.
Aye.
The second item I have for your consideration is draft ordinance number 3338. That's being presented as a result of a recent discovery by city staff of livestock being kept in a suburban-style backyard while we were investigating another matter. The city recognizes that there are locations within the city limits that where appropriate space and appropriate zoning for keeping livestock as described in the ordinance exists. The city also recognizes that reasonable restrictions are appropriate for the keeping of livestock in order to preserve the health, welfare, and safety of citizens and the livestock alike.
I'd like to move that we adopt ordinance number 3338, an ordinance of the City of McPherson, Kansas, amending Chapter 10, Article 1, Section 3 of the Code of the City of McPherson, Kansas, regarding establishing the allowance of and regulations for the keeping of livestock within the city limits, and authorize the mayor to sign the ordinance.
I'll second it.
All those in favor say aye.
Aye.
Okay, thank you very much.
Thank
Call
you.
on Chief Weisman. While he's coming up, I'll thank him for continued work at the fire department, for the farm to market food distribution, and maybe next week we'll get truck delivery correct and be able to truly have the distribution that we're expecting.
Yeah, we'll see.
No comment, right?
I think
That's
the
a
only-
losing
the-
battle right there.
There you go.
The only way we can do it is if we have trucks picking it up in Kansas City and driving
Yep.
it here.
And we're scratching and clawing to get it done. So
Yeah.
we'll work through it, whatever it is, every week. The first item we have for you is several SCBA's were in need of repair to restore them to service. Municipal Emergency Services repaired and flow tested those packs to meet regulations. We request a motion to approve payment to Municipal Emergency Services for SCBA repairs for an amount not to exceed $1,112.58.
I'll move to approve the payment of municipal emergency services for self-contained breathing apparatus repairs for an amount not to exceed $1,112.58.
I'll second it.
All those in favor say aye.
Aye.
Second item, ladder one sustained a front hub seal failure. Conrad Fire Equipment was contacted to fix the problem. The wheel hub was disassembled and the seals and bearings were replaced. Request of payment to Conrad Fire Equipment for an amount not to exceed $1,314.73 for the necessary repairs to the ladder truck.
I'll move to approve the payment to Conrad Fire Equipment, Inc. for repairs to ladder one for an amount not to exceed $1,314.73.
I second it.
All those in favor say aye.
Aye.
Next item, Pizza Hut in McPherson conducted a fundraiser for McPherson Fire Department. They collected $700.71 over the duration of the fundraiser. We'd like to say thank you to Marcia and her team out at Pizza Hut. We request a motion to accept that donation of $700.71 for Pizza Hut in McPherson.
I'll move that we accept the donation to the McPherson Fire Department from Pizza Hut fundraiser in amount of $700.71.
I'll second.
All those in favor say aye.
Aye.
If you remember a few weeks back, we spent that on some medical equipment to actually aid with COVID response too. So they got some new suction units and stuff from it. So.
Good.
The fire department was awarded the Volunteer Fire Assistance Grant through the Kansas Forest Service. The grant is a 50-50 matching. This year, the department was awarded $4,000 to purchase personal protective equipment. We request a motion to accept the Volunteer Fire Assistance Grant through the Kansas Forest Service for $4,000. That's $1,000 or $999 less than what we've received in the past. So I'm not sure if COVID had any issues with that, if that's what is contributing to that being less this year or not. But
Okay, I'll move to accept the Volunteer Fire Assistance Grant through the Kansas Forest Service for the McPherson Fire Department in the amount of $4,000.
I second that motion.
All those in favor say aye.
Aye.
With that, we request a motion to approve the purchase of the wildland personal protective equipment from Conrad Fire for $831.60, and from CoPro Emergency Fire Products for $7,652.50, for a combined total not to exceed $8,484.10. When we budget this, we budget 50-50. We had $5,000 in the budget for it, so.
Okay, I'll move to approve the purchase of wildland personal protective equipment from Conrad Fire Equipment, Inc. for $831.60, and CoPro Emergency Fire Products for $7,652.50, for a combined total of $8,448.10.
I'll second it.
All those in favor say aye.
Aye.
The fire department responded to a call for service on a hazmat incident. During the mitigation of the incident, a level A suit sustained damage to the visor from chemicals involved. The chemical permeation of the suit rendered the suit out of service. We billed out the expense and received payment for it. We request permission to replace the suit to bring our response capabilities back to normal. The suit is a Kapler Frontline 500 Vapor suit. We request a motion to approve the purchase from Mid-Continent Safety for an amount not to exceed $2,375.
I'll move to approve the purchase of Kepler Frontline 500 Vapor Suit from Mid-Continent Safety for the fire department for an amount not to exceed $2,375.
I second that motion.
All those in favor say aye.
Aye.
Next two items we have are personnel matters. We had two paid call firefighters that submitted their resignation. Morgan Jones, she joined the Air Force and is resigning effective immediately. We wanted to tell her thank you and wish her well on her service to the country and the Air Force. Darian Bush is leaving to attend PA school in Texas and resigned effective July 30th this year. We want to say thank you to Ms. Bush and wish her well in becoming an efficient physician assistant. If you would like to read their resignations, they are attached. We request a motion to accept the two paid call firefighter resignations.
I'll move to accept the resignations of Morgan Jones, paid call firefighter, effective immediately, and Darian Bush, paid call firefighter, effective July 30th, 2020.
I'll second that.
All those in favor say aye.
Aye.
Eric Unruh interviewed successfully for the position of paid call firefighter. We feel that Mr. Unruh would be a valuable addition to our paid call ranks, and we request a motion to hire Eric Unruh as a paid call firefighter effective July 27th this year.
I move to approve conditional job offer to Eric Unruh for the position of paid call firefighter, pending successful pre-employment requirements effective July 27th, 2020.
I second it.
All those in favor say aye.
Aye.
The farm to family, we're hoping that it goes off without a hitch, as we discussed earlier this week. We should be receiving hopefully a numerous amount of trucks this week with more produce and more mixed dairy products. Last week we had we asked for, or we were expecting, a 1 truck full of milk, and we got a truck and a half full of milk and 2 half trucks full of produce and mixed dairy. So this week we hope that we get what we've requested, and there should be plenty to go around. The lines were pretty long. I think that the police department did an excellent job of keeping the traffic at bay and organizing stuff. We're trying to fix a few hiccups that we had with bulk loading, and a lot of that had to do with when we were loading out the other communities, the trucks were late, so it delayed that process. We like to have that process done before we distribute to the rest of the community, but unfortunately last week it didn't go that way. We did get rid of all the milk, and so we did very well last week. So I appreciate the patience and the kindness from the community and getting through those processes, and hopefully it goes that well again this week.
Day and time this week?
Friday, 10 a.m. is when we're going to distribute. That's very tentative. So,
Okay,
let's
that's
see.
10 o'clock is if trucks are on time.
Yep. One other thing I would like to comment on, the Fuse fundraiser that we have, that's an MDA fundraiser. That allows the kids with muscular dystrophy to go to a camp. We do that fundraiser every year to try, that's what pays for that. So we encourage the public, if they can, to come out, really participate with that. It allows those kids to go and mingle together, and especially with COVID, they already have some comorbidities or dispositions that make it harder for them to go out and interact. So if we could get them to Fuse Camp, and we would really appreciate everybody supporting that.
Give the date and time again.
That was August 15th. That's a Saturday. And Adam and I will be on the radio Friday. He'll tell more about that.
Okay,
Okay, good.
August the 15th.
Yes.
Yeah, and that's
Support
hosted,
MDA.
yeah, it's hosted by our Fire Benefit Association and supported by us. So
Okay,
Okay.
good.
Thank you.
Thank you.
Okay, you're on the big spender board here. Now we'll bring up Jeff, see if he can erase your position.
Good morning, everyone.
Morning, Jeff.
First item I have is out of the street department. It's a curb driveway approach and street repair at 1101 Grimes Street. The repair's actually on Loomis. We have a street and driveway approach and curb repair needed. The material estimate that we put together is $2,942.28.
I move that we approve curb driveway approach and street repair on Loomis at 1101 North Grimes for a cost not to exceed $2948.28 for material only.
I'd second that.
All those in favor say aye.
Aye.
The next item is out of the wastewater treatment facility. We had a failure in the piping below grade on the reuse system in the pump room. Before the breach was discovered, pumping large amounts of water below the floor occurred, creating voids. The movement of the piping system damaged the pipe, needs to be repaired, and a hole needs to be cut in the pump room floor to see what the extent of the voids and damage is underneath the room. We received 2 quotes. The lowest quote was from UCI Wichita in the amount of $18,752. Once the extent of the damage is found, more repairs will have to be made.
And I move that we approve payment to UCI Wichita to fix damaged piping on the reuse system and cut an exploratory hole in the floor of the pump room at the wastewater treatment facility for a cost not to exceed $18,752.
Second.
All those in favor say aye.
Aye.
Now I'd like to give you an update on the construction projects we have ongoing. First is an update on the Grimes-Anna Street reconstruction. Work continued on backfilling and general cleanup items. We hope to finish this project this week. There are no street closures associated with this project. Next, an update on the Hardup Elizabeth Street reconstruction project. Hardup Street, the second 350-foot section south of Hancock, the main run of curb and gutters complete. The contractor started work on driveways and tie-ins. Hardup Street, Elizabeth to Kansas Avenue, the pavement was removed and excavation was started. Hardup Street, Avenue A to Hancock is closed to through traffic with local access from Avenue A, Hancock, and sites. Through traffic on Hardup Street is detoured onto Park. Hardup Street, Elizabeth to Kansas remains completely closed. Next, an update on the Halls area drainage project. No work was completed on the First Street box. Work continued on pavement for the box at Wheeler, Crescent, and Myers. Hall Street is currently open, Grimes to North High Drive. Crescent Lane and Wheeler Street are both closed completely from Hulse to Normandy. First Street is closed between the high school and North High Drive. Traffic will be detoured on Maxwell, Kansas, and Maine. Next, an update on the Chestnut Street Improvement Project. The contractor is back on the project. Work on installation of storm sewer and moving lateral sewer lines continued. The street will remain open through construction. when possible, with very limited parking. There will be times when streets are closed, but residents should be able to access their properties from one end of the block or the other. I'd like to remind everyone that weekly construction updates, road closures and detours, planned road closures and planned detours are available on the city's website at www.mcpcity.com. That's all I have unless there's any questions.
Just a comment, we're working hard with the contractors to get the First Street bridge complete, as well as the sidewalks at the intersection of North High and Hulse, get those completed before school starts, so hope to accomplish that.
It's
Thank
going
you.
to be close, the same as Hard Up and then the intersection of Park and,
Exactly.
and Elizabeth. It's going to be close, but we hope to accomplish that.
Do is our best, so. Okay, administrative report.
The first item I have for you today is approval of McPherson Housing Coalition Service Agreement for fiscal year 2020. The city received notice from the Kansas Housing Resource Corporation on June 24th that they'll be funded at 200% of what was funded for the previous 2019 grant year, and that's as a result of the CARES Coronavirus Funding Act in 2020 that provided some additional assistance there to be spent for homelessness-related resources. Kansas Housing Resource Corporation received notice that they will receive an additional $6.2 million in budget year 2020. CARES Act provides for the allocation of homeless assistance programs to prepare for, and to respond to coronavirus among individuals and families who are homeless or receiving homeless assistance, and to support any additional homeless assistance and homeless prevention activities to mitigate the impact created by coronavirus. So our hope was that we would receive at least 100%, but due to this, the CARES Act, we were fortunate enough to get that additional 100% to get us to 200%. ESG CV grant period will be for 12 months, starting July 1st, 2020, and will so it's already in effect, and will go through June 30th, 2021. However, the ESG coronavirus program may be extended due to identified need and availability of additional CARES Act funding. In previous years, the city would submit a grant application in order to receive funds. This year, as noted above, we received the funds as a result of the CARES Act funds. So basic applications are submitted as a matter of formality on July 9th, 2020, as required by the Senior Administrative Specialist for Kansas Housing Resource Corporation. The city was awarded back in 2020 grant funds as listed. For homelessness prevention, it's $65,500. Rapid rehousing, it's $114,000. For HMIS, which I don't know 100% what that all stands for, but it's basically computer software training as it relates to this program for $2,660. And then also administration of the grant, which is $9,193. So each year, this is a pass-through grant, so it's received by the city through KHRC, and each year we turn around and award it to the McPherson Housing Coalition. Each year we have a service agreement that we bring before you guys to adopt between us and the McPherson Housing Coalition, which commits funds for those services that McPherson Housing Coalition will provide, which equates to $183,160, and the administration proceeds in the amount of $9,193 are also given to the sub-recipient of the city of McPherson. Richard Miller, who's our Assistant Finance Director, works directly with the McPherson Housing Coalition to make sure that these funds are used properly as they are required by their grant. Richard serves on their board, but also has been administering this for a number of years. And so at this point, what we ultimately need is a motion to consider that service agreement.
I'd make a motion to approve the 2020 service agreement with McPherson Housing Coalition as provider of homeless prevention, rapid rehousing, and HMIS service to qualified applicants under the Emergency Shelter Grant Program, ESG, beginning July 1, 2020, retroactive, and ending on June 30th, 2021, for an amount not to exceed at $183,000, $183,160, and authorize Mayor Brown to sign the service agreement.
I second it.
All those in favor say aye.
Aye.
From time to time, the city evaluates professional brokers who secure insurance for the city of McPherson for various lines of insurance. And back in 2019, it was determined that broker selection would be evaluated for the property casualty liability auto portion of coverage for this 2020 year, going into the 2021 year. With the assistance of James Charlesworth Consulting, the city of McPherson underwent a selection process for interested brokers. We did receive interest from two interested brokers that wanted to bid on this service. We had an extensive interview process, demonstration process. We demonstrated their portal site. We did some reference checks, and we went through a number of evaluative measures to kind of make a decision. And this was all undergone by an insurance review committee, which is primarily made up of our finance committee and also Mayor Brown, and also led by, we also had partnership from BPU in there as well, because BPU is also tied in with those lines of insurance as well. And as a result of that, it was a unanimous decision by the Finance and Insurance Committee to keep Assurance Partners out of Salina, Kansas as our insurance broker for those lines of coverage. The review committee is asking that the governing body authorize moving forward with Assurance Partners as the city's property casualty auto liability auto provider, and also authorize staff to develop a modified agreement with Assurance Partners for the services in the future going forward.
I'll move to authorize selection of Assurance Partners as the city/BPU property casualty liability auto insurance broker, and authorize staff to negotiate a modified agreement with Assurance Partners for their service.
Second that.
All those in favor say aye.
Aye.
I did want to announce it's that time of year. The McPherson Landfill Corporation is basically formed out of an agreement with KDHE and the city when they closed the old landfill site, which is to the south part of town. We made the agreement that we would keep in place this landfill corporation, which is made up of the board of city commissioners, and it's annually we're required to meet to talk about any of the expenses or any of the activities that happen as it relates to the closed landfill. We'd like to have that meeting on July 20th at 8 a.m. prior to the regular commission meeting that morning, and have it here in this building at 400 East Kansas, here in this room, McPherson, the commission room, and that is a public meeting that's open to anybody that wishes to attend. And this is more of just a notice to let you know that will be happening, and so you can expect that to happen next week.
Right.
And finally, I'm ask your approval to hire Eric Unruh. Fire department paid call fire, going at $25 per run drill. That would be effective July 27th.
I move we approve the wages.
I'll second it.
All those in favor say aye.
Aye.
Okay, I would like to move that we go into executive session under provision of attorney-client privilege as it relates to potential litigation for 15 minutes from 10:12 to 10:27. No, yeah, 27. Confused myself.
Okay.
Okay, we are back in session. And I don't believe that we have any COVID items to bring before us. The study sessions are over, the executive session is over with
We haven't gone
no
through the study session yet.
decision, huh?
We did, you didn't go through the study session.
Let's go
Oh,
to
I
study
still gotta
session.
do the study session.
Let's go to study session.
I'm not getting enough oxygen with this mask. Let's go to the meetings.
I didn't say that.
Yeah, you could have. It wouldn't have
Yeah.
mattered. I'm thick-skinned anymore. Okay, I'd like to move that we adjourn the city commission meeting.
Second.
All those in favor say aye.
Aye.